Hello friend, welcome to the channel Pharmacy Dictionary. We have started Pharmacokinetic, and under the topic of Pharmacokinetic, we have studied about the movement of drug across the cell membrane. Now we have to start another basic parameter of Pharmacokinetic. These are ADME, and in today's topic we are going to start the A, that is absorption of drug. So what is the meaning of absorption of drug? What are the basic important? Why this topic of absorption is so important along with different ADME process? So first of all, we should know the meaning of absorption. Absorption is the process, or we can say passage of drug molecule from its site of administration to the circulation. Whenever we used to take any medicine, that depends upon the different route of drug administration, and we have already completed the process of movement of drug according to the route of drug administration. So it is the movement of drug from its site of administration. It may be either topical, it may be either oral, sublingual, buccal, parenteral, or any other some usable drug route like vaginal, rectal, subcutaneous, etc., etc. So in any of the route of drug administration, the final aim or purpose of the drug to be taken is their absorption to the circulation, so that that drug may produce their effect except the local route of administration. So it is very important to reach the drug from its site of administration to the circulation, so that along with the blood it may move throughout the body and may produce its pharmacological response. In this case of pharmacological response, most of the cases as we expect or intended effect of drug is their therapeutic effect, but it is not compulsory and it is not totally restricted with this desirable effect. Somehow undesirable effect can also be achieved with any kind of drug if the drug is not suitable for any group of patient who is not suitable, who is not susceptible for the kind of effect. So it may consider as a pharmacological effect. Now coming to the most important note under this absorption point, that rate and extent of absorption is totally dependent upon the route of drug administration. So in this case of absorption, the route of drug administration, to understand this topic is very important. So you should apply the knowledge of route of drug administration in this case of absorption. Rate and extent is also known. Though I have written rate and extent of absorption, has mark is there, that means bioavailability. So in other words, we can say bioavailability totally depends upon the route of drug administration. Suppose if you are taking any drug via oral route of drug administration, then to perform its pharmacological activity, then to produce a desirable activity, that drug, if it is solid dosage form, then it should go for the disintegration, dissolution, then only that will come to the circulation. So it will take time. The rate and extent will be delayed. But if you are talking about the parenteral route of drug administration, either IV or IM, the drug will give their effect as compared to the oral route very fast manner. So that will be a rapid effect. So we can say the rate and extent or bioavailability is dependent on the route of drug administration. So according to the different route of drug administration, we have to study about the main two important route as per the absorption form. The drug will be absorbed from which route? Basically we can say from gut and from parenteral. From gut, that means that drug will be absorbed via the GIT, gastrointestinal phases, and from parenteral, that means the drug will absorb parenterally, and that means apart from the intestinal route. That may be IV, IM, SC, or any other suitable route of drug administration. So from the gut, let us start with the first point, that from gut. What are the basic criteria and what are the basic process of the absorption of drug from gut area? So first one say highly lipid soluble drug absorbed from the buccal cavity. If you are talking about the oral route of drug administration, that is also came under the oral, that also come under the gut route of administration. So if you are talking about the lipid soluble drug, or we can say highly lipid soluble drug, so whenever we will place the drug under the buccal cavity, they will absorb very fastly and they will reach the systemic circulation, and they will produce their desirable or somehow undesirable effect. That's depend upon the drug profile and patient history. So second point under the gut absorption, say acidic drug. This is the one of the most important point you should remember in case of your sessional examination as well as for the GPAT and other competition exam point of view. Acidic drug absorbed from stomach. The acidic drug will be absorbed from stomach. It is very important because this is a major question in examination. While the basic drug get ionized, the most important hindering factor for the absorption of drug is their ionization. So ionized form of drug will not be absorbed from the stomach, and they may create problem because they act That means ionized drug act as a macromolecule. So basic drug in stomach get ionized and become or behave as a macromolecule so that they will not be absorbed. What is the meaning of ionization? See, you have to remember this point. Unionized drug will be absorbed easily, but ionized drug will not be absorbed easily, because ionization means, suppose this is an example, just for example, NaCl. So if you break this NaCl, there will be a Na plus Cl minus. So we are having charge Na plus, that is a plus charge, Cl minus, that is minus charge. So these will, Na and Cl minus plus respectively, will behave as an ion and they will behave as a macromolecule, so they will not be absorbed from the gut area. Now intestine have the large surface area, most of the drug absorb here. If we are talking about the intestine, there are two subtype of intestine, you know it very well according to their size and distribution, small intestine and the large intestine. So in case of pharmacology, the most important part of absorption is your small intestine, not your large intestine. So many of the drug get absorbed via the small intestine because it's a long surface area. So small intestine provide larger surface area to the drug so that they may absorb very easily. Although name indicate large intestine, but it does not mean large intestine is a site of absorption in case of pharmacology, and that do not have that much length as compared to the small intestine. So small intestine is a major site of absorption just because of surface area. Now let me explain you regarding surface area, because it is very important. If you are talking about the surface area, what does it mean? See, it is my hand. It may be something for 50 to 60 centimeter approx. Just for example, if I am applying all the tubes of any cream, beauty cream or whatever it is, antiseptic cream, in this particular same part, or just pour out all the content, squeeze out all the content of that particular packaging material, cream material, and leave it. Will it produce desirable or good effect? No. But if you spread this cream overall in my hand, they will absorb faster because you are providing that cream to the larger surface area, and that effect will be higher as compared to the particular part of that hand or over the hand side. That is called surface area. Now coming to the next point, that is another important point. Basic drug are absorbed here, where in intestine. So basic drug are absorbed here due to their favorable pH. Acidic drug are absorbed in the stomach, while basic drug are absorbed better in the intestine. In few cases that may be exceptional also, like enteric coated or something else, or desirable absorption or some hindering factor or targeted drug, that may be a variable thing, but in general these parameters are to be followed. Now next point, that is important note again after this note. So absorption is negligible from the large intestine. As I have explained you earlier, the most important path or site for the absorption is small intestine, not a large intestine. The major functional or physiological action of large intestine is just to absorb the water from the stool, and that stool can be evacuated in the form of bowel movement. So that is another part, but that absorption will not take place from this site of that means large intestine. Next, that are the factor influencing drug absorption. This is the main point of today's lecture. So we will continue most point in the upcoming whiteboard section of the same video. So what is the meaning of factor influencing drug absorption? It is not a rocket science, but it is very important. There is no such rule that will apply the same thing each and every time. If you are taking a drug and getting X response, so it is not compulsory that you will take the drug in the next few days and you will get X response too. The response may be variable according to different parameters. So all those parameters which may affect or which may influence the action of drug can be considered under this factor affecting drug action. They may either increase the action of drug via increasing the absorption of drug, or they may decrease the action of drug via decreasing the absorption of the particular drug. So there are so many parameters, there are so many factors which may affect the drug, but all those factors are included or concise under few subheadings. These subheadings are, first one is pharmaceutical factor. We will see each factor in detail in upcoming whiteboard section. So first one is pharmaceutical factor, that is totally dependent upon the manufacturing process, type of manufacturing, etc., which is completely depends upon the manufacturing unit only. Second one is drug factor, that means pharmacodynamic factor. What is the basic profile of drug? Is it lipid soluble, is it water soluble, or something else it is having property? So that factor can be considered under the drug related factor. Next parameter is biological factor, that means a biological factor of that particular patient who is taking this kind of medicine to achieve any kind of pharmacological effect. Under the biological effect, we should understand the effect of food and effect of GI motility. If you have eaten something which is not favorable for the drug absorption, absorption, that may hinder the absorption process. But if I have taken some food which may facilitate the absorption of that drug, that can increase the bioavailability, that can increase the rate and extent of the drug. So this is important. Food may affect the drug in two ways, either increase or decrease its absorption, and the effect is totally proportional on the absorption area. Next one is motility, that was gut motility. How is the peristaltic movement? Is the food along with the drug can easily pass through, rapidly pass through, or it will take much amount of time so that it may absorb very good amount, and that may absorb very finely. That's depend upon this factor. So coming to the last factor which may affect drug action is patient related factor. This is important, but it is not as important as the previous one. What is the meaning of patient related factor? Patient related factor is a factor which is totally directly related with the patient. Suppose I have to take any kind of diuretic, but my kidney is not functioning properly, so that may cause problem. If I have something other problem which may affect the absorption of drug, that may create problem. If my psychic condition is not good, that may also affect the absorption of drug. If I am having different kinds of abnormality or some genetic defect, that may directly or indirectly affect the action of drug, like in case of idiosyncrasy we have discussed in earlier topic. So all these parameters are very important, that will directly or somehow indirectly affect the absorption of drug. So we will now going to start the factor influencing absorption of drug in the same video in the next whiteboard section. So let's move to the next part. In this section of whiteboard, we are going to study about all those important factors which may influence the rate of absorption of any dosage form from any route of drug administration, that will finally alter its pharmacological effect. So there are so many important factors under which the important categories are. The first one is pharmaceutical factor, the next one is drug related factor, next one is biological factor, and we have merged the patient related factor in this biological factor here also. So first of all, we have to study about the pharmaceutical factor. What is the meaning of pharmaceuticals factor? If you have studied about the pharmaceutics in your B Pharm, D Pharm, M Pharm or any other respective discipline, then you should know the meaning of pharmaceuticals. That means a branch of science, or we can say a branch of pharmacy, which completely deals regarding the formulation, synthesis, their specific dosage form, manufacturing of any respected drug which has been approved by different regulatory authority. So in this case of pharmaceutical factor, we have to study about the all kind of formulation factor, is additive importance effect on the drug release, or any other factor which is directly related with the manufacturing of any suitable medicament. So there are so many other sub points regarding this pharmaceutical factor. The first and most important is disintegration and dissolution time. What is the meaning of disintegration and dissolution time? As you can see in this word, there is two words are combined to make a proper meaningful sentence. This is disintegration. The meaning of integration is to combine, but in case of disintegration, that is get opposite of that process. That means separation or just breakdown of the molecule of higher size into a smaller size. That's called disintegration. And dissolution means completely disappearance of that particle which had been separated from its main parent part. That is called dissolution. That means disappearance. So in this case, disintegration is only applicable with the solid dosage form, that are tablet, capsule or some kind of granules, but it is not applicable for the liquid dosage form, because liquid is already in solubilized form, but we have to make them soluble. So this is important parameter. Now I am going to explain you this point with the help of diagram, and I am going to explain you one demonstration too. So here in this beaker, as you can assume this as a beaker, or you can assume this as a inside view of stomach also. So this is a tablet, solid dosage form of any tablet. There are two types of tablet. First one is disintegrated tablet, having so many agents that will facilitate the process of disintegration, like effervescence tablet also, and the second one is normal tablet. So this is solid dosage form, we can say these are the tablet. So after reaching to the stomach, there are so many fluid present inside the stomach. It may be water which you have taken during the meal, or any other biological fluid. So in this case, the drug which is in solid state get distributed as a small particle, and that process of conversion of large particle into small particle is simply known as a disintegration. That means breakdown of a larger particle size. Now what will happen after the disintegration? After the disintegration, that tablet which has been separated separated as a small particle will completely disappear because that particles are completely solubilized in the given vehicle. So this is vehicle, it may be either water or any other fluid which you are taking about, which you are talking about also. So that is disappearance, that's called dissolution, and dissolution will increase the rate of absorption. So I am going to explain you the same process with a demonstration. I have a beaker. On my another hand, I have another beaker. So I am having two beaker. Let me explain you the first. First of all, I am going to explain the process of disintegration with a normal tablet. This is a Digene tablet. So see in the beaker what is going to be happen with this case of Digene tablet. I am taking one Digene tablet and I am going to place this Digene tablet on the beaker which is having water. For some time, please assume this beaker as a stomach and the fluid inside the beaker can be assumed as a biological fluid. So as you can see, the tablet put in the beaker and it is as it is looking like. Now I am going to replace this tablet with another tablet, that is Disprin. Have you ever eat or taken Disprin? So this is Disprin. I am going to take a Disprin and put the same Disprin over the beaker as like the case of Digene, but you will see the difference what's going to happen with this tablet. So here is a Disprin and here is the water inside beaker. I have just placed the Disprin. As you can see, the effervescence granules are releasing. Just after placing the tablet into the water, they get started disintegration, and after some time they will complete dissolve and the solution of the Disprin and the water is ready to be taken, and that will give faster absorption rate as compared to the Digene one. As you can see clearly, the rate of disintegration as well as dissolution is very much higher for the aspirin or Disprin, but in case of Digene it is not as faster as compared to this beaker. So this is the important parameter. Now as you can see, the complete dissolution of the Disprin has taken place inside the beaker, but yet it is about to be happen. So this is basic example of disintegration and dissolution. So this disintegration will facilitate the rate of absorption, and increase in the rate of absorption will increase its pharmacological effect, and that will give faster effect. That means called duration of action will also be affected by some case, but onset of action will be, particularly for this tablet, will be higher. So the next point is formulation factor. Under the formulation factor, parameters are method of formulation. Like in case of tablet, there are so many other methods like dry granulation method, wet granulation method. These two methods of tablet manufacturing, dry and wet, can affect the rate of disintegration as well as dissolution, and finally they will affect the rate of absorption, and ultimately they will also affect the rate of effect producing, that means onset of action. Apart from the method of manufacturing or production, there are some additive which may affect the release of drug, or we can say absorption of drug. These are starch binder and guar gum, gum acacia, etc., which are used as a diluent, fluent or binding agent. Suppose if some tablet is having a large quantity of binding agent, that tablet is having harder in shape, harder in appearance, so that will take longer time to be disintegrated and then after for dissolution. As now you can compare, the tablet of Disprin has completely disappeared in the water, completely dissolved, but the Digene tablet is still in its original or in initial state. So those drug which is having large amount of binder, large amount of joining agent, other type of pharmaceutical additives may affect its dissolution, disintegration rate, finally its absorption. Now next is a particle size. This is another important parameter for the absorption of drug. If the particle size of any drug is larger or higher or greater, then it will take much time to get disintegrated, then for dissolution, then for absorption, and finally it will take much amount of time for producing their effect. But in case of smaller particle, it will get easily distributed, easily disintegrated, easily dissolved, then all the process will be faster as compared to the large one. So particle size is very important. As you can see in this equation, smaller the size, better the absorption. So this is important parameter, as you can see in this respective representative diagram. If the particle size is large, it has to get disintegrated into smaller particle, but in case of smaller particle, it is already in small size, so it will take less amount of time to be dissolved. Now coming to the next parameter which may affect or influence the rate of absorption of any drug, this is drug related factor. All those factors which are the property of drug which can be affect the rate of absorption just because of the property of particular drug, individual drug for which you are talking about. These are lipid solubility. As we have studied in the previous topic, like distribution of drug across the cell membrane, in that case you have seen the passive diffusion. The drug which are lipid soluble can easily get solubilized in the cell membrane phospholipid bilayer, and they move from extracellular region to the cytosol region without the need of any aqueous pore. So we can say, we can conclude, we can concise the factor that only those drugs which are lipid soluble or highly lipid soluble drug get faster absorption. Their absorption will be faster because they are having lipid soluble property. But in case of water solubility, they will require aqueous pore to be transported from extra to intracellular, and that will be a rate limiting step. Now next one is pH and ionization, the another important factor for the absorption of drug. pH and ionization may be influenced by different factors. With your food, that may be also affected, but whatever reason is not important as the final result, that if the pH alter of your GIT or any other body part, they may affect the absorption of drug. How? Ionized drug will be poorly absorbed. Those drugs which are in ionized form will behave as a macromolecule, larger size of molecule, and that will be difficulty for their absorption. So ionized drug poorly absorbed. This is one of the most important question you should remember, because such question may be asked in your sessional or theory examination. Now second one is ionized form will act as a lipid soluble, and we have seen just now that lipid soluble drug will produce rapid absorption, and once the drug's absorption is rapid, their absorption will be faster. Once the absorption is faster, their pharmacological effect can be achieved in a very short duration of time. So next point, acidic drug get unionized as stomach. We have studied the point that unionized drug get absorbed faster. So if you are talking about the acidic drug, then this acidic drug get unionized in stomach, so that they will produce better absorption. Example for the such kind of drug are aspirin, barbiturate. You know it very well that these drugs are acidic drug, and this drug can be absorbed faster in stomach, because in case of stomach they will be in unionized form. This is important. Unionized, that means faster absorption. Ionized, that will be a slow absorption as compared to the unionized case. Now coming to the next biological parameter, these are very important, and these are directly related with the patient related factor. That's the property of our own body that may affect the action, absorption, duration, intensity, onset of action of any drug which you have been taken for any desirable purpose. These factors include surface area. I have explained you regarding surface area. Surface area is a direct proportional property. If you want to increase the absorption of drug, you should provide larger surface area. So we can conclude that larger surface area will provide larger absorption, better absorption, because if you are going to apply the drug, whole tube of the ointment or cream in a particular restricted part, how that drug can be absorbed very fastly. But if you apply or spread the drug throughout your body or throughout the larger surface area, that will be absorbed faster, because it is having lots of site for the absorption. From that particular site, they may absorb via the different route that may converted into that may reach into the blood circulation, depending upon the route of drug administration and drug to drug. Now second point is GI motility. This is important but little bit confusion. GI motility means motility of gastrointestinal tract. That may be of two types. The first one say gastric emptying time. What is the meaning of gastric emptying time? The time at which gastric content get empty. That means movement of food particle from the stomach towards the small intestine. If the movement of drug along with the food particle from the small intestine is faster, then it will reach to the small intestine faster in a less amount of time, and then the absorption will be faster. But on the other hand, you can see there the intestinal motility increase, that will decrease the absorption. What is the meaning of intestinal motility? This is alag. This is different thing. Gastric emptying is another phenomena, and the intestinal motility is another phenomena. If intestinal motility, that means peristaltic movement. If you are taking any food, any drug, and just because of diarrhea, dysentery, the all food material along with the drug get passed or get eliminated to your rectal route, very quick succession. That means there is no time for the absorption. We can say there is no contact time between the drug along with food to your small intestine, so the drug will not be able to absorb by the small intestine, so the drug will be eliminated very faster. And if there is a lacked amount of time, of if there is no contact time between drug and small intestine, the absorption will be obviously hindered or retarded. Now next point is food presence. If you are taking so many before taking any drug or just after taking any drug. So the presence of food may affect the absorption of drug just because of hindering effect. And there are some types of food which are play a specific role in case of drug to drug. Some food can favor the absorption of drug, but in case of some difficult condition, some food may affect the absorption of drug in a negative manner. That means the food may retard the absorption of drug, and this is a part of different topic we will see in upcoming lecture. The next one is disease state. If someone is having disease condition, like someone is having kidney problem, so the elimination of drug from your body will be retarded, and if you are taking another drug simultaneously, the drug will be retained in your body, the drug will be concentrated in your body. So there are some chart which can suggest you which are the drug which can concentrate it on a specific part of your body, so they may affect the absorption of drug too. Disease state is very important. It may be either kidney disease or liver disease or any other problem associated with the patient who is taking such kind of drug. Next one is route of drug administration. The one of the most important parameter under the biological factor that affect the absorption of drug is route of drug administration. We have completely seen the topics of route of drug administration with a specific demonstration too. So if you are taking any drug via oral route of drug administration, and if the drug is in solid state, then the drug has to pass this following stage: disintegration, dissolution, then only that will be reached to the systemic circulation. But if you are talking about the parenteral, so the drug will directly injected inside the blood vessels, inside the vein, so there is no need of disintegration, dissolution reaching to the systemic circulation. The drug will fastly available for the circulation, and that will produce their effect in a very successive time. So coming to the next parameter, these are biological factor, these are very important factor. So as per this parameter, you can concise your points, you can remember your point for your exam point of view. So friend, that's all for the day. Thank you very much for watching this video. The reference for today's topic is K.D. Tripathi latest edition, that is 8th edition, P. Jagdish Prasad and Padmaja Uday Kumar. If you do not have all these books, do not worry, I will give you the time to take a screenshot. After some time you will be able to take a screenshot of this whiteboard section. So at the last, thank you very much. Please do take care of yourself, and please do not forget to give your feedback under the comment box. Thank you.